So if you or someone you love is dealing with age-related macular degeneration, you know it's a lot to handle. But there's this other challenge that sneaks up on you, one that we don't talk about enough, the financial side of it. In this quick guide, we're going to break down the real and often hidden costs of AMD treatment and give you a simple game plan to get back in control.
You know, this quote just hits the nail on the head, doesn't it? That feeling right after the diagnosis, it's not just about your health. It's suddenly about your schedule, your bank account, your whole life. It feels like an ambush. And that's exactly what we're here to do. Help you see it coming and get ahead of it. All right, so here's the first thing that catches almost everyone off guard. The real financial gut punch of AMD isn't one giant, scary bill. Nope, it's the little ones. It's the steady, predictable rhythm of all these smaller costs that, visit after visit, start to add up in a big way. Okay, so how do you get a handle on all of this? Well, the key is to stop thinking about it as one big, messy pile of expenses. We're going to introduce a new framework, a really simple way to separate your spending into two distinct lanes. And this little shift in thinking can change everything.
And here it is. This is the game changer. You've got the clinical lane. That's all the stuff you'd expect, right? The doctor visits, the tests, the injections. But then there's the life lane. This is everything else. The cost of getting to the appointment, the time you or a loved one takes off work, and honestly, just seeing it this way, just separating the two, is the biggest step you can take toward getting control.
So this all boils down to three really crucial takeaways. First, forget trying to budget for a whole year at a time. It's too overwhelming. Start planning per visit. Second, always keep those clinical costs and life costs mentally separate. And third, and this is a big one, you've got to realize that the frequency of your appointments is the real lever you can pull to manage your overall spending.
Now that we have that framework, let's get really specific. Let's map out exactly where the money goes. When you actually see all 9 of these cost categories laid out together, it can be a real aha moment.
And here they are. Just take a look. The life lane has just as many items as the clinical lane. We're talking about gas and parking, a caregiver's lost wages, even the time and energy you spend dealing with insurance paperwork. These are all real, actual costs that are so easy to miss when you're just focused on the medical bills.
Let's just zoom in on one of those for a second, caregiver time. It's so easy to dismiss this as just help from family, but it has a real economic cost. Just ask yourself these questions. Do you need a driver? Are you going to the doctor monthly? Is the person helping you missing paid work to do it? If you're nodding yes to a couple of these, then that support is a real, significant cost you need to account for.
Now let's talk about the secret ingredient that makes all these life lane costs blow up. It's one simple word: frequency. This is the thing that turns a tiny expense into a major budget item.
I mean, look at this math right here. $20 for parking or a ride share, it feels like nothing, right? But what happens when you do that 12 times a year for your appointments? Boom, that's $240. Just like that, a tiny life cost becomes a real annual expense, and that's just for one thing.
And once you truly get that, once you realize it's the frequency of the small stuff that's the real budget killer, it leads to this huge shift in your mindset. This is the moment where you stop feeling like a victim of the costs and start becoming the manager of your own financial plan.
Look, we all do it. You see the crazy high price of the medication itself, and you think, okay, that's the problem. That's the monster I have to fight. All the headlines are about the drug cost, so that's where we put all our focus. But then comes the realization. The truth is, it wasn't the one big thing. It was the rhythm. It was the constant drumbeat of appointments and all those small extras, the parking, the gas, the time off, the lunch you grab on the way home, all of that together started to make more noise than the actual clinical bill.
So this brings us to a new powerful rule. It's simple. Stop thinking about your annual budget. Start thinking per visit. Treat every single appointment like a little event that gets its own micro budget and its own micro plan. This one change makes the whole thing feel so much more manageable.
All right, so how do we actually do this? How do we put this new mindset into practice? Let's build a really simple system you can set up, well, today. And I promise this isn't about some complicated spreadsheet. It's just a few easy steps to make this whole thing survivable. Okay, here's your 15-minute plan. 4 simple things. First, just jot down 3 of your life costs for each visit, like gas, parking, a copay. Second, figure out about how many appointments you've got in the next 3 months. Third, call your insurance and ask them flat out what your cost is per injection. And fourth, decide on one sustainable way to get to your appointments to reduce that stress. The whole point is to create a predictable routine so you're not getting ambushed every month.
So let's end with this one simple question. Don't try to solve everything at once. Just look at your life lane and pick one thing. Maybe it's transportation, maybe it's just planning for parking, and make a simple plan for it today. Because taking control of just one small thing, that's the most powerful first step you can take to get your peace of mind back.